Well, this year, South Africa celebrates 25 years of democracy and quite recently celebrated the 10th anniversary of legislation and legalization of the same-sex marriages. Now, despite these achievements, most of South African society still remains closed off to the idea of two men in a sexual relationship. The South African HIV LGBT plan, launched in 2017, highlights the stigma and deep discrimination as being one of the leading impediments to men who have sex with men testing and being on treatment. Well, the campaign, launched by the country's largest health NGO, Me1st, late last year, targets men who have sex with men and encourages them to test for HIV and get on treatment should they test positive. To discuss this a little bit more, we're joined in studio by the Right to Care Group Chief Operations Officer, that's Ian Ralph, and Me1st Ambassador Phumlani Kango. Good afternoon, gentlemen, and thank you so much for your time on the SABC News Desk.
Thank you very much for inviting us.
Welcome. Ian, let's start with you. Can you tell us how the Me1st campaign was born? And one would think that crucial to this issue is creating an awareness around the understanding of LGBTI rights, what these rights mean and what they encompass.
So the campaign actually was grounded about a year ago. We're funded by the Global Fund to fight HIV, AIDS and TB, and this campaign was supported by them. But we did some preliminary work about a year ago with our partner organisations, and there are a number of partners we work with, to actually start to establish what people who have, or men who have sex with men, what services they actually really wanted to see and what they needed to access. And so the preliminary groundwork was done, and then last November, with the support of the Global Fund, we actually went big time with this, and it's been an incredibly successful campaign. We've reached a very large number of people, and I think one of the biggest surprises has been that lots of men who have sex with men know their HIV status. Many know that they're HIV positive, and one of the big questions that we've been asked is, how do people get onto treatment? And that's really critical for us. So we have two priorities within the campaign. One is to get people tested, and people who are negative actually stay negative, and that people who are positive actually go on to treatment and actually stick to their treatment and remain on treatment, and once they're on treatment, they are successfully on treatment, they are untransmissible. So we have this phrase which is U equals U, which is around people being undetectable, having a viral load that's not detectable, and then they are not able to transmit HIV to their partners.
Phumlani, you've been the face of this campaign and rolling out into communities, being the ambassador, and Ian has mentioned two priorities: getting people tested and then making sure there's an adherence to that treatment. What kind of traction has the campaign found with the communities you've rolled out in?
So it's been very interesting because the conversations I've had on my social media have been enlightening, in the sense that people have the access to the information, however they don't know where to go. So for example, Ian mentioned that we've got partners that we work with. So for example, in East London, we've got a partner that we work with in East London. So I'm from the Eastern Cape, so I've been getting a lot of people asking me, like, where can we access help, where can we go, where can we get this, where can we get tested for HIV. So for me, it was one of those things that it's always been there, but people never knew about the access to the healthcare that they need. And for me, it's also been like interesting in the sense that the conversation has changed when it comes to talking about HIV, because in the Eastern Cape, okay, for example, in the Eastern Cape, people have always like spoken about HIV in sort of like a negative way. So you have nicknames for it, you've got whatever they call it. But now the conversations around more about taking ARVs. Have you taken your ARVs today? Have you gone to the clinic? And so that's for me has been the most interesting thing about this campaign in particular.
I have to ask you this, in most of our communities, men having sex with other men is still such a taboo subject almost, and still deeply stigmatized. How willing are men to come forward and actually reveal their status and their sexual orientation at that?
Okay, so we've had this discussion for quite some time when it comes to people and how they identify. So when we say MSM, we're not referring to a sexuality, it's a sexual preference. So these are men that actually have sex with other men. So for example, sex workers. We have people, men that are in jail, for example. And we also have men that are in facilities where they don't have access to a lot of things. So some people actually compromise on their sexuality so that they can actually survive, as I said, in jail. So when it comes to understanding that, I think society needs to first understand identity politics when it comes around MSM, because the biggest issue is the fact that we always mention that if I'm MSM, you're going to call me gay. And that's the biggest issue why people aren't going out to get tested, because if I identify as someone who is a man that has sex with another man, but I still like women, then people want to box me into bisexual. So I think the biggest thing is that we need to first have a conversation around identity politics, as a society, so that we can actually understand the MSM culture and MSM individuals as well.
Ian, there have been so many incidents of hate crimes that have been made headlines in recent years. And I have to ask you this, how serious do you think South Africa is right now about gay rights or M2M rights or so on? Because we do seem to be walking a fine line between strong constitutional commitment to protecting this and actually doing this, and this translating from paper onto the ground.
So I think South Africa is actually quite far advanced. As Right to Care, we do work in lots of other countries in Africa and beyond. And the political context of MSM is very positive in South Africa, but it never translates into a reality on the ground for very many people. There is always going to be prejudice, there is always going to be hate around some of these things. But I think generally South Africa is doing reasonably well, but of course there's always room for improvement.
Because these kind of hate crimes are not actually recognized as unique crimes in South Africa just at this point. What do you think are some of the barriers? Is it just a lack of political will at this point?
No, I don't think it's a lack of political will. I think obviously the justice system is completely overwhelmed in South Africa, and so how does this rate in the priority of crimes that are committed? There are very serious crimes committed. There are people murdered for their sexual identity, and those crimes are dealt with appropriately, but the general day-to-day hostility or violence that people experience is perhaps not quite receiving the priority attention it should within a justice system that is very, very heavily overburdened.
Okay, Phumlani, your campaign is wrapping up today, actually, I believe. How do you plan on keeping the momentum going forward?
So I'm very open, so I talk about my sexual health and my sexual experiences openly. So I'm going to carry on the conversation, and also at the same time encourage people to go visit the facilities that we actually have been working with on the Me1st campaign. So as I said, for example, in East London, a lot of people that didn't know that there's She, which we work with. In Northern Cape, we've got Lifeline. In Durban, we've got the LGBT Community and Health Safety Center. And in Bloemfontein, we've got the Rainbow Free State Seeds. So a lot of people didn't know that they actually have these facilities. So I'm going to carry on the conversation and encourage them to actually go and visit some of these facilities, get tested, find out more about PrEP, find out more about PEP, and that's basically what I want to be doing.
Gentlemen, we are out of time. Thank you so much for joining us, Ian and Phumlani, on the SABC News Desk. We do wish you well in your future endeavours.
Thank you.